Right, guys. Welcome to Public Health Facts and Cholera. So, to basically finish off the industrial period. Right. Just a little bit of background. Population, how much that has a big impact on health. Huge boom in the population. You guys might remember it from year 8, the Industrial Revolution. You've got movement into towns. With that comes other problems that link to our topic. You look at that statistic, growth of towns, 85% of people lived, causing overcrowding, poor sanitation, no running water, shared toilets, little sewage systems. This is going to lead to the epidemics of cholera. There was a man who was trying to get the bottom of this, Edwin Chadwick. In 1842, he completes a report on the conditions. He finds life expectancy is lower in the city than in the countryside, unhealthy living conditions because of overcrowding. Again, no sewage disposal, poor diet, rotting sewage and filth. So he was a believer in miasma theory, and that's what was causing people ill. He recommended, new systems to be involved, the removal of waste and boards of health. So Chadwick is somebody who, in government, who is trying to get the ball rolling here. We are still in the kind of laissez-faire kind of attitude of the government, but Chadwick is somebody who's showing that he wants to act. So why was he important? As I've just said, he is demonstrating that the government is starting to move away from this laissez-faire approach. They had just left people to themselves to deal with public health, and his report helped the government kind of push them to think, right, you need to do something, which will lead to our first Public Health Act. Chadwick actually tries to push the government on financial grounds. He says, listen, you have, it's within your interest to do something, because the amount of people who are getting sick, that means they're off work, and if they're off the work, they're not producing anything, and that means the country's generating less money. So Chadwick did use that angle to kind of push the government to do something, and this does lead to the Public Health Act of 1848. So what was the Health Act of 1848? Well, there's not a lot to it really. In terms of its impact, it's pretty much nothing, but it is significant to show the government is actually doing something. So that's how we can use it in terms of its importance, and the way we can use it in an extended writing piece or in the GCSE, a question comes up to really show government action. This is a good example to show how the government is making steps to what we will be the Public Health Act of 1875. So it basically wanted to improve sanitary conditions, and it encouraged, look at the play on words there, it encouraged cities to set up boards of health and provide clean water. It didn't force them to do that. That is significant. Because it wasn't compulsory, basically cities didn't follow it. They just carried on doing what they were doing. So it was largely ignored. Again, importance of it shows the government taking action, however, not enforced, so it was a massive problem. And then we get this fella, Jon Snow, who a lot of you, well, all of you should be familiar with. We need to think about what Jon Snow actually does. Well, to understand that, it's looking at cholera a bit. So cholera, horrible disease causing diarrhea and sickness, usually fatal from person to person in contaminated water. Historically, it would destroy armies. If you have your army in the field and you don't dig your latrines properly, cholera can wipe out an army quite easily, and that is the gathering of people together. Now, why it's so important in this period is because before this period, we have many people in the countryside, a bit more spread out. Now, with a huge amount of people in the cities and the lack of proper toilets and sewer systems, cholera is rife, and this is why we have 4 different epidemics in this period of cholera. The first one is 1831-32. You're having nearly 22,000 people who die of cholera in that year, and then 48-49, you have 53,000, a huge amount of deaths, and then the one we're going to come to is 53-54, which Jon Snow gets involved in, which is 20,000. And then I'll talk a little bit about the 1865-66 one, which actually drops to 14,000, and we'll talk why that figure is a little bit lower. But what were the attempts to stop it? Well, they believed it was miasmata, like the theory of miasma was causing it. Again, a really good one to use if cause of the disease, a similarity between medieval and industrial. Miasma is a good one to do. So local councils, they turned their attention to to the mess in which they were living in. So the government encouraged cities to set up the boards of health, provide clean water, similar to the 1848 Public Health Act. However, nothing actually really got done. Now, Jon Snow was aware of these cholera outbreaks. He moves to Soho in 1836, and he had become like a leading anaesthetist. Sorry if I'm butchering that, but it's basically somebody who administers anesthetics, because he was the one who delivered chloroform to Queen Victoria, which was James Simpson's discovery. So see how we can connect some of our big figures. He was quite popular and he was respected. Now, he was aware of the cholera outbreak in 48-49, and he did write up his theories. He challenged the idea of miasma being the cause, because when he was testing individuals and patients who suffered from cholera, he saw that it was affecting the gut and not the lungs, which he believed, if you're breathing in this foul air, surely the disease would be affecting the lungs. But no, it's affecting the gut. So how can it be something you breathe in? And he also thought it could be the drinking water that was being contaminated. So these were his initial ideas from the early epidemic. And then the epidemic from 1854 hits, and this breaks out in Soho, where Snow actually lives. And Snow decides to investigate an area where 93 deaths had occurred. Now, he creates a spot map. So he points out the different individuals who had died in this area around Golden Square and Broad Street. Now, he took the street map, drew those spots to represent the deaths, and pinpointed it all came around the Broad Street pump, which you'll all be familiar with. Snow, to him, it was clear that the water pump was the source of the infection, so he removed the handle from the pump, preventing locals from pumping water, and the cholera outbreak went away as quickly as it basically arrived. This kind of proved to Snow his theory. Further inspections actually found that the water pump was close to a cesspit, less than a meter away. Even though it had like brick lining, the cesspit, which is basically a pit of where all your waste goes to, it cracked, meaning it was seeping into that drinking water. There's just a graphic of his investigations. Do have a look. It does tell you the little story about how there was the anomaly, the woman living in Hampstead, several miles away. When he went to investigate it, she was actually travelled to the Broad Street pump because she liked the taste. There's also why didn't the workers of the brewery why weren't they getting infected by cholera? And that was basically because they were drinking beer all the time, not the water. So to Jon Snow, it was pretty clear what was happening. But his impact. Now, again, this is another one where short term, whilst taking the handle off Broad Street pump had an immediate impact to people in the local area, elsewhere it didn't have a massive impact, and there's reasons for that. Again, it's more his long-term impact that we need to be aware of. Just these are things to really bring into the high-level answers to show limited initial impact, but then a high impact later on. And I'll talk you through that. So he presents his findings in 55. Basically tells them you need to sort out the sewage systems to avoid another outbreak. Now, the government does do this. It takes a bit of time, but Joseph Bazalgette, he basically plans the sewage system and completes it in 1875. So it does get done. So you can say, right, John Snow's findings did directly lead to the new sewage systems, but it was also the Great Stink that kind of prompted it. So there was a horrible summer in 1858 that, remember, all this, when they were cleaning up the cities to try and get rid of cholera, they were dumping everything into the Thames, and this hot summer had reduced the water levels in the Thames, and all that stinking mess, trash was just laid out, and the government had to do something. So this had an impact on the sewage systems as well. However, as I said before, many rejected it. So the General Board of Health, they stuck to this miasma theory, which provided clean water, because the idea, John Snow's recommendation of providing clean water would be quite expensive, and the boards of health were reluctant to do that because they said there was no scientific proof that clean water would actually work, so why waste the money? Yes, you might be thinking, well, didn't Snow have a lot of evidence? He did, but it was practical evidence. He didn't have the scientific evidence that linked, which proved the cause of the disease. This wasn't until, remember, this is why I'm always pointing out the way we can get the higher marks in the judgment questions. Pasteur's germ theory really showed that link between germs and cause of disease, and then 30 years later with Robert Koch finding the cholera bacteria, which really did the job. So again, the germ, this is why germ theory is so important. It really does prove a lot of people's works, and especially Robert Koch's finding different bacteria cause different disease. It's such a huge momentous finding, and this really proves John Snow's work. I mean, John Snow was never alive to really be appreciated in terms of what he found, but other scientists' findings prove it for him. Right, so what kind of happens really after this cholera outbreak? Well, in the 1860s, the government is really starting to take action here. 1,300 sewers were built in London. The slums in Birmingham were demolished. In Leeds, a local business obtained court order to prevent sewage from being drained into the river from which they got their water. And more people were recognising, right, it's your responsibility. It's your responsibility to sort this out. And this leads to the Public Health Act of 1875, the bigger one, and one that I've seen quite a lot being a focus of a question. But you can bring it in as well. It's a great one if you get anything about, let's think of a question. So the opening of the NHS in 1948 was the most significant government action in prevention of disease from the periods, let's say 1800 to present. And if you've got them dates 1800% present, you can have a disagreed paragraph on the Public Health Act of 1875, can't you? So this is how we can use it, if it's not a focus question where it's already one of the bullet points. So what does this do? Well, these changing attitudes, remember that word laissez-faire, changing from laissez-faire to government taking action. And importantly, with this act, it was enforced, so the city authorities had set rules and responsibilities to follow. Now, it's going to be tricky to remember all of these bullet points that I'm going to put down, but if you can remember like a handful, that should sort you out. That's enough evidence. That's what I'll be looking for when I'm marking. At least 2, 3, 4 bits of evidence would be enough. But what does it do? Provides clean water, disposing of sewage, and prevent drinking and washing water from being polluted. Building public toilets, employing public officer of health to monitor disease outbreaks, ensuring housing was of better quality to stop dampness and overcrowding and that spread of disease, providing public parks for exercise, inspecting lodge houses to ensure they were clean and healthy and weren't like this kind of area where disease is going to break out, creating street lighting, and checking food quality. So it was really significant. This is really the start of public health. So yeah, the last one was 65-66, the last cholera outbreak. And a lot of these measures, I know that's before the second Public Health Act, but a lot of the measures that were brought out in the 60s helped massively reduce the number of deaths during this epidemic. That's why it's a good 5,000 lower than the next one. So just bear that in mind. Right, that covers everything in industrial. Again, please use this alongside other bits of revision. You need to be practicing those questions as well. Remember, guys, if I've got time, I'll try and put out a structure video, but you know, I need to try and get the modern period out to you before Wednesday. Okay, so again, have a good one.